I must state that for safety, honesty and cautious reasons, the information in this video was gathered through research on the internet. I am not telling you to do anything in particular. Your choices are of your own volition. Seek medical advice for further knowledge.
What is sickle cell anemia and how does it affect the body? Sickle cell disease, also called a sickle cell, is a group of inherited hemoglobin-related blood disorders. The most common type is known as sickle cell anemia. Sickle cell anemia results in an abnormality in the oxygen-carrying protein hemoglobin found in your red blood cells. What does sickle cell anemia do? Sickle cell anemia causes red cells to become stiff and they start looking like a crescent-shaped cell. This then leads to various health problems. These sickle-shaped cells can block blood flow, causing pain, infections and damage to organs like the spleen, kidneys and the lungs. Additionally, the abnormal red cells have a shorter lifespan than the healthy ones do, resulting in chronic anemia. Signs, signals and complications. Painful episodes. Sickle cell crisis. Blocked blood flow can cause severe pain, often in the chest, abdomen and the joints. Pain varies in intensity and can last for a few hours or a few days. Some people have only a few pain crises per year. Others could have up to a dozen or more a year. A severe pain crisis requires a hospital stay. There's people with sickle cell anemia who also have chronic pain in the bones and they can develop ulcers as well. Other causes can be put down to sickle cell also. Signs, signals and complications. Anemia. The shortened lifespan of sickle cells lead to chronic anemia, causing fatigue and shortness of breath. Typical normal red blood cells usually live for about 120 days before they need to be replaced, but sickle cells usually perish within 10 to 20 days, leaving a shortage of red blood cells. Organ damage. Blocked blood flow can damage various organs, including the spleen, kidneys, lungs and the brain, leading to long-term health problems. Sickle cell disease can weaken the immune system, making individuals more susceptible to infections. The stroke. In severe situations, blocked blood flow to the brain can cause a stroke. Acute chest syndrome. This serious complication involves chest pain and a fever, difficulty breathing due to blocked blood flow to the lungs. Sickle cell disease can lead to other complications like bone damage, blindness and priapism, which is a stiff and overly firm wood, prolonged and painful erection. Inheritance. The sickle cell disease is an inherited condition, meaning it is passed down from parents to offspring. It's an autosomal recessive disorder, meaning both parents must carry a copy of the mutated gene for a youngster to inherit the disease. Management and treatment. Early diagnosis and treatment are crucial for preventing and minimizing complications. Pain management. Pain relieving tabs are used to manage a pain crisis. Blood replacement treatment. Blood replacements can help improve anemia and reduce the risk of a stroke. Hydroxycarbamide has been used for many years to treat blood disorders. It has also been found to be beneficial in sickle cell disease. Myelofibrosis. This is a rare chronic blood disease where bone marrow scar tissue fibrosis replaces the healthy tissue, hindering blood cell production. This leads to various complications, including anemia, fatigue, and enlarged spleen. It's also a type of myeloproliferative neoplasm. Bone marrow scarring. The hallmark of MF is the replacement of normal bone marrow with fibrous tissue, disrupting blood cell formation. Blood cell abnormalities. Myelofibrosis can lead to low counting red blood cells, being anemia. It can also lead to low counting white blood cells and platelets. Signs and signals. Fatigue, the shortness of breath, abdominal discomfort due to an enlarged spleen, bone pain, night sweats, and easy bruising are common signs. Diagnosis. Diagnosing myelofibrosis involves blood tests, bone marrow biopsy, imaging tests to check out the spleen size. Back to the video at hand after that little detour. What is sickle cell anemia and how does it affect the body? We're on management and treatment. So here's some other treatments. These include bone marrow implanting, antibiotics and vaccinations. Signs and signals of sickle cell anemia usually start to show at around 6 months of age. They vary from person to person and may change over time. Swelling of the hands and feet. Sickle-shaped red blood cells block blood circulation in the hands and feet, which can cause them to swell. Frequent infections. The spleen is important for protecting against infections. Sickle cells can damage the spleen, raising the risk of developing infections. The youngsters with sickle cell anemia commonly receive vaccinations and antibiotics to prevent potentially life-threatening infections such as pneumonia. Delayed growth in youngsters. Red blood cells provide the body with oxygen and nutrients needed for growth. A shortage of the red healthy blood cells can slow growth in youngsters and delay development in teenagers. Vision problems. Tiny blood vessels that supply blood to the eyes can become plugged with sickle cells. This can damage the portion of the eye that processes visual images, called the retina, and lead to problems with vision. When to see a healthcare professional. See your healthcare professional straight away if you or your offspring has signs of sickle cell anemia, including fever or the stroke. Infections often start with a fever and can be life-threatening because youngsters with sickle cell anemia are prone to infections. Seek prompt medical attention for a fever greater than 100.5 degrees Fahrenheit or 38.5 degrees Celsius. Seek emergency care for signs of stroke, one-sided paralysis and weakness in the face, arms or legs, confusion, difficulty walking or talking, sudden vision changes, unexplained numbness or severe headaches. Sickle cell anemia is caused by a change in the gene that tells the body to make hemoglobin. Hemoglobin is the iron-rich compound in red blood cells that allows these cells to carry oxygen from lungs to the rest of the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky and crescent-shaped in appearance. For a youngster to have sickle cell anemia, both parents must carry one copy of the sickle cell gene and pass both copies to the youth. If only one parent passes the sickle cell gene to the youth, they will have the sickle cell trait. With one typical hemoglobin gene and one sickle cell gene, people with the sickle cell trait make both typical hemoglobin and sickle cell hemoglobin. Their blood might contain some sickle cells, but they generally don't have any signs or signals of it. They're carriers of the disease. This means that they can pass the gene to their youth in the future. Pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. Shortness of breath and fatigue are common signs of this condition, which can be fatal. Splenic sequestration. Sickle cells can cause blockage in the spleen, causing it to enlarge. This may cause abdominal pain on the left side of the body and can be life-threatening. Parents of youth with sickle cell anemia can learn how to locate and feel their spleen for enlargement. Gallstones. The breakdown of red blood cells produces a substance called bilirubin. A high level of bilirubin in the body can lead to gallstones. Leg ulcers. Sickle cell anemia can cause painful open sores on the legs. Deep vein thrombosis. Sickled red blood cells can cause blood clots, increasing the risk of clot lodging in a deep vein, known as deep vein thrombosis. It also increases the risk of blood clot lodging in the lungs, known as a pulmonary embolism. Either one of these can cause serious illness, or even worse, you could perish and drop out. Pregnancy complications. Sickle cell anemia can increase the chances of high blood pressure and blood clots during pregnancy. It also can increase the chances of miscarriage, premature birth, and having low birth weight newborns. Is sickle cell a disability? Yes, sickle cell disease is often considered a disability under the law, specifically the Equality Act 2010 in the UK. This is because the signs and complications of sickle cell disease, such as pain, fatigue, plus the limitations on physical activity, can substantially and negatively impact a person's ability to perform normal daily activities. Here's why. The definition of disability. The Equality Act 2010 defines a disability as a physical or mental impairment that has a substantial and long-term adverse effect on a person's ability to carry out normal day-to-day activities. The impact of sickle cell disease. The chronic pain, fatigue, and other complications associated with SCD can significantly affect a person's ability to work, participate in social activities, and perform everyday tasks. Legal protection. This means that individuals with SCD are often entitled to legal protection and reasonable accommodations in various settings, including employment and education. Examples of impact. For example, a person with SCD might need to take frequent breaks at work due to pain or fatigue, or require adjustments to their work schedule to accommodate medical appointments. Not considered automatically disabled. It's important to note that a diagnosis of SCD doesn't automatically mean someone is disabled under the law. The extent of the impact on daily life is a key factor in determining disability status. A hidden disability. Sickle cell disease is also considered a hidden disability, as the effects can vary greatly from person to person, and some individuals may appear healthy between episodes of pain and other complications. What does sickle cell pain feel like? Sickle cell pain, also known as sickle cell crisis, can feel like a dull ache or sharp jabbing pain and can be mild to severe. This pain can come on suddenly and out of nowhere, affecting different parts of the body like the arms, legs, back and the abdomen. Some individuals describe it as worse than being in labour or post-surgical pain. Can sickle cell affect Caucasian people? Yes, sickle cell disease and sickle cell trait can affect people of all ethnicities, including Caucasian people. Although it is more common in people of an African descent, SCD is not exclusive to any particular ethnicity. It's important that individuals of all backgrounds to be aware of their sickle cell status, especially if they have a family history of the disease or come from populations where it's more prevalent. A quick blood test can determine if someone has sickle cell trait. How to test for sickle cell. It is diagnosed through blood tests that detect the presence of the abnormal hemoglobin, which causes the blood cells to become sickle-shaped. The importance of testing. Testing for sickle cell disease allows for early diagnosis and management of the condition, potentially preventing complications. Carrier testing is important for individuals who may be planning to have youngsters of their own, as it can inform them of their chances of passing the condition on to their offspring. In the UK, screening for sickle cell and thalassemia is offered to all pregnant women and newborns to identify those who may have the chance of being carriers. What foods should those with sickle cell avoid? Limiting meat with high iron content, fast foods and refined foods is also important for sickle cell disease. Does sickle cell cause yellow eyes? Yes, sickle cell disease can cause yellowing of the eyes, a condition known as jaundice. The yellowing of the eyes happens because the sickle-shaped red blood cells break down more rapidly than normal, leading to a build-up of bilirubin, a yellow substance in the body. Why are sickle cell sufferers skinny? Due to the increased energy expenditure associated with this hematologic anomaly, youth with SCD are at risk of being underweight, particularly those who are not on any chronic treatment. Eating fruits and vegetables has many health benefits. For example, pomegranates for increased blood flow, and fruits and vegetables such as bananas and kale boost energy levels. These benefits are especially advantageous for people with sickle cell anemia. So why do people with sickle cell eat so much? Youth with sickle cell disease need a diet that provides plenty of calories and protein, vitamins and minerals. Their bodies use more energy because they break down red blood cells faster than other youngsters do. Higher energy needs make it common for affected youth to be shorter and thinner than their peers. Does sickle cell get worse with age? As you get older, you may develop different and more serious medical problems that happen when organ tissues don't receive enough oxygen. The difference between sickle cell disease and sickle cell anemia. Sickle cell disease is an umbrella term for inherited blood disorders. Sickle cell anemia is the most severe form of sickle cell disease. People with sickle cell disease inherit 2 copies of the sickle cell gene, one from each parent, while those with sickle cell trait inherit only 1 copy of the gene. A detailed explanation. Sickle cell disease. This is a broad term. It encompasses various inherited blood disorders characterized by sickle-shaped red blood cells. The red blood cells become stiff and sticky, forming a sickle or crescent-shaped instead of a normal disc shape. Inheritance. This requires inheriting 2 copies of the sickle cell gene, one from each parent. The signs and signals. These can vary in severity and may include anemia, pain crisis, acute chest syndrome, or the stroke. Examples. These include sickle cell anemia, HBSS, sickle cell hemoglobin C disease, HBSC, and sickle beta thalassemia. Sickle cell anemia, specific form. This is the most common and usually the most severe form of sickle cell disease. Inheritance. specifically refers to the condition where a person inherits 2 copies of the HBS gene, one from each parent, resulting in the HBSS genotype. Sickle cell anemia, the signs. Chronic hemolytic anemia, which is the low red blood cell count due to premature destruction of red blood cells. You've got the vaso-occlusive pain crisis and potential organ damage. Severity tends to be more severe than other forms of sickle cell disease, with a higher possibility of complications. Often used interchangeably, sickle cell anemia is a specific type within the broader category of sickle cell disease.
Can sickle cells be cured? Yes, sickle cell disease can be cured through stem cell or bone marrow replacement. While bone marrow replacements have been a long-standing option, gene therapy, including CRISPR-based techniques, is showing promise as a potential cure for some patients, particularly those with severe sickle cell disease. Another groundbreaking gene editing treatment, exa-cel, has also been approved and is showing promise as a potential cure for some individuals. Stem cell bone marrow replacement. This is the only current established curative treatment for sickle cell disease. This involves replacing a person's faulty bone marrow with healthy bone marrow or stem cells from a donor. In a best case scenario, the donor should be a close relative, like a sibling with a matching tissue type. The replacement can stop pain crisis, preventing further complications and improving quality of living. Sometimes though, these replacements can carry risks, including rejection and complications, and they are not always suitable for everyone. Gene editing therapy, exa-cel. This is a treatment which involves editing a person's own stem cells to produce non-sickling red blood cells. These edited cells are then infused back into the person. Since it uses their own blood cells, the chances of rejection are eliminated. Gene editing and showing promising results, with many people experiencing a slowing or cessation of a sickle cell crisis and improvement in their overall health. Other potential cures. Research is ongoing to develop other potential cures, including gene treatments that can be administered directly into the body, potentially making treatment more accessible and affordable. Researchers are also looking at how to alter blood stem cells inside the body rather than having to remove and replace them. How hard is it to live with sickle cells? Sickle cell disease is a lifelong condition, and yes, there's a cure available, but stem cell replacements aren't always available and come with many chances of treatment misfiring. Early diagnosis and treatment can reduce the signs and signals and chances of complications. With ongoing care, you can go on to lead a full, active lifestyle. What is the rarest blood type? The rarest blood type is AB negative. It is the least common among the 8 main blood types, with about only 1% of people having it. While AB negative is the rarest within the ABO blood group system, there are even rarer blood types such as Rh null, sometimes called golden blood, which is extremely rare, with fewer than 50 people known to have it. O positive blood is a blood type characterized by the presence of the Rhd antigen on red blood cells, meaning it is Rh positive, and the absence of both A and B antigens. What is blood type O positive? It is the most common blood type, with around 35% of blood donors having it. O positive red blood cells can be safely moved into anyone with a positive blood type, A positive, B positive, O positive or AB positive. A more detailed explanation. ABO blood group. O positive individuals have the O blood type, meaning their red cells do not carry either the A or the B antigens. The Rh factor. They contain the Rhd antigen, making them Rh positive. Universal recipient. While O positive blood can be given to anyone with a positive blood type, they themselves can only receive blood from O positive or O negative donors. The importance in emergencies. O positive blood is often used in major trauma situations when O negative blood isn't available due to its higher prevalence. Commonness of this blood type. In other words, how many people around actually hold this type of blood. O positive is the most frequent blood type, with about 1 in 3 blood donors having this type of blood. What are the 3 rarest blood types? The rarest blood types are AB negative, B negative, and AB positive, in that order. AB negative is the least common, followed by B negative and then AB positive. AB negative. This is the rarest blood type, with only about 0.6% of the population having it. B negative. This is found in approximately 1.5% of people. AB positive. About 3.4% of the population has this blood type. However, type O blood is often associated with a lower risk of certain cardiovascular diseases and has a lower chance of contracting some tumours. And with that being said, some people though with type O blood may be more prone to peptic ulcers. What is a peptic ulcer? A peptic ulcer is a sore that develops on the lining of the stomach, or the duodenum, which is the first part of the small intestine. These sores, also known as stomach or duodenal ulcers, are often caused by an infection with the bacteria H. Signs and signals. These can include burning or a gnawing pain in the abdomen, indigestion, heartburn, and nausea. Some people may not experience any signals at all. Complications. If left untreated, peptic ulcers can lead to serious complications, such as bleeding, perforation, a hole in the stomach or intestinal wall, and blockage of the digestive tract. The treatment of peptic ulcers. Treatment typically involves antibiotics to eliminate H. pylori if present, and certain prescriptions to reduce stomach acid, and you can also make lifestyle changes. Blood type A. With this blood type, you may be at a higher development chances of gastric tumours and some other tumour-based ailments. Blood type B. With this blood type, you may be at a higher risk for blood clots and heart disease. Blood type AB. With this, you may be at a higher chance of having a stroke and blood clots. Individual variation. It's crucial to remember that individual health is influenced by many factors beyond blood type, including lifestyle, diet, and genetics. So here's some other important considerations. Further research. While some studies show associations, more research is needed to fully understand the complex relationship between blood type and health. No guaranteed protection. Having type O blood doesn't guarantee protection against disease, and people with other blood types can still live long and healthy lives also. Focus on healthy routines. Regardless of the blood type, maintaining a healthy lifestyle
which includes a balanced diet, regular exercise and stress management, is always essential for overall health and well-being. Are there any benefits to having sickle cell anemia? Being a carrier of the sickle cell gene has an evolutionary reward, believe it or not. Those with just one copy of the sickle cell gene avoid the worst symptoms of the disease and are also protected against malaria. What is the best pain relief for sickle cell? If you have sickle cell crisis, you can usually manage it at home. Take over-the-counter pain relievers such as paracetamol or ibuprofen. If the pain is more severe, your GP may prescribe a stronger pain relief. Why do people with sickle cell have a big stomach? Splenic sequestration occurs when sickled red blood cells get caught in the spleen and block blood flow, causing it to suddenly get bigger, fill with blood and become swollen and painful. The spleen is an organ in the upper left part of the abdomen that backs up the body in the fight against infection. Is bad weather rough for sickle cell sufferers? Any cold, windy or rainy weather can make the blood vessels smaller, making sickling of the red blood cells, and pain on these days is more likely. So walking to the bus stop on a cold morning, or even swimming in a cool pool and then getting chilly in the changing rooms can set off sickle cell pain. So in summary for this video, let's go over all the facts. Sickle cell anemia is a genetic blood disorder where red blood cells become stiff and sticky, forming a sickle or crescent shape. They can then block the blood flow, leading to pain, infections and organ damage. It's caused by a gene mutation affecting hemoglobin, the protein that carries oxygen. Treatments focus on managing signs and preventing complications like the pain crisis and infections. Genetic inheritance. Sickle cell anemia is an inherited condition, meaning it's passed down from parents to offspring through their genes. Abnormal hemoglobin. The condition results from a mutation in the gene that codes for hemoglobin, the protein within the red blood cells responsible for carrying oxygen. This mutated hemoglobin, called HbS, causes red blood cells to become stiff in texture and sickle-shaped. Blood flow obstruction. Sickled red blood cells are less flexible and can get stuck in small blood vessels, blocking blood flow and depriving tissues and organs of oxygen. The sickle cells can block the major blood vessels that bring oxygen to the brain. Any interruption in the flow of blood and oxygen to the brain can cause severe brain damage. Painful episodes called the pain crisis. These are a known hallmark of this condition and can be severe and debilitating. Infections. Sickle cells can damage the spleen, an organ which is crucial for fighting infections, making individuals more susceptible to illness or ailments. The stroke. In worst case scenarios, sickle cells can block blood flow to the brain, leading to a stroke. Management. There is currently no freely available cure for sickle cell anemia, other than the treatments we mentioned earlier on in the video. These treatments focus on managing signs and preventing complications. These may include pain management, over-the-counter pain relievers to relieve pain during crisis, infection prevention, vaccinations and antibiotics to prevent these. There's blood replacement treatments to replace sickled red blood cells with healthy ones. Bone marrow replacement. In some cases, a bone marrow replacement can be a curative treatment, though it carries significant risks. Some newer treatments. Research is ongoing to develop new treatments that may offer a cure for sickle cell anemia. People with sickle cell disease may have a reduced life expectancy. New treatments for SCD are improving life expectancy and quality. People with sickle cell disease can survive beyond their 50s with optimal management and organisation. Stem cell or bone marrow treatments are the only near cure to sickle cell, but they're not done often because of the significant risks involved. Stem cells are special cells produced by bone marrow, a spongy tissue found in the centre of some bones. Right, so I must say, I do sympathise with those who have this condition. Although, of course, I did know of sickle cell prior to this video. What you had to deal with was vague and a bit unclear. It sounds like quite a lot if I'm honest. You're stronger than most for not giving up. Touché. So yes, as I make these videos and give you crucial health and lifestyle information, to a certain extent, I'm also educating myself along the way also. You never know what a person is dealing with behind closed doors or health-wise. Manners and respect is due until showing they don't deserve it. Wishing you all the best in life. Good luck.